Hello, I'm Dr. Helen Pinsanti, and welcome to Doctor, where medical conversation meets everyday understanding for you and your health. Today, we're going to be talking about a skin condition that affects over 30 million Americans. You've probably heard the name, eczema. It's a dry, itchy patch, but it can be more serious with painful, frustrating, isolating situations and embarrassing because other people can see it on you. But there is hope and there is help. Joining me today is Dr. Bryn Henderson, a familiar and respected voice in the world of regenerative and integrative medicine. Welcome, Dr. Bryn Henderson.
Well, thank you.
Dr. Henderson, I'd like to just let our audience know that you're a board-certified physician with strong focus on regenerative medicine, preventive care, innovative therapies that blend traditional science with emerging healing techniques. You've helped thousands of patients live better, healthier lives. You're going to help us understand eczema. When someone comes into your office and they have medical history of eczema, what does that really mean?
Well, the skin condition, it causes a dry, itchy, inflamed skin, and it often shows up as red patches and scaly areas, can feel very uncomfortable. Eczema is not contagious, but it tends to come and go. Some people have it since they were kids, while others develop it later in life. It's more than just dry skin, though. It's a chronic condition that involves the immune system and often runs in families.
All right, so you're saying it could be genetic. It could be you're born with the immune system of your parents, your great grandparents, your great grandparents. So why do some people have it in their family and others don't?
Good question. Eczema happens when the skin barrier does not work as well as it should. For many, this is due to genetics. They may even have a mutation in a gene, which helps keep the skin strong and moisturized.
What is that gene called?
It's called flagrin. The skin is weak, the moisture escapes, and the irritants get in. On top of that, the immune system overreacts, and things like stress, allergens, and even cold air can cause that inflammation. So it's a mix of genetics, the environment, and a faulty immune response.
All right, so we talked about that it could be genetics. So what is the percentage if one parent, say, has eczema? What is the chance of their child getting both versus both parents having it?
Yeah, and that goes to the heart of genetics. If one parent has eczema, there's a 30 to 40% chance that their child will get it. If both parents have it, that risk jumps to 50% or more. And it's not just eczema. A family history of asthma and allergies also increases the chances.
All right, well, that's fascinating to me. I know you do a lot of research and a lot of study. So for someone who doesn't know what it looks like, obviously the people listening who have it know exactly what it looks like. But for those who don't know, they've heard the word eczema, probably someone saying, oh, I've got eczema. But what does it really look like?
Eczema usually looks like dry, red, and patchy. It can be rough or flaky sometimes. It even oozes with a crust, especially if it's been scratched. People often get it on their elbows, behind their knees, their neck, hands, or even on their face, heaven forbid. Over time, the skin gets thick and leathery, and from all the scratching, that's the reaction. But on the darker side, it might look darker brown or purplish than red.
So a doctor who is looking at a patient, and it might be a darker skinned patient, it actually is purple?
Can be. And it definitely can be dark brown, too.
All right, let's go over the different types of eczema, and let's explain, because I know there's several, and I'd like the audience to know those different types.
There's several types. The most common is atopic dermatitis. But there's also contact dermatitis, which happens when the skin touches something that's irritating. And that could be certain soaps or metals. And there's dishydrotic eczema as well, which are teeny little blisters on your hands and feet. And then there's another eczema. It's nummular eczema. It shows up as a round spot. Then there's seborrheic dermatitis, often on the scalp, and stasis dermatitis on the lower legs due to poor circulation. Each one has its own unique features and triggers.
All right. You said the word trigger, so we're going to go to triggers. What should people watch out for?
Triggers vary from person to person, but usually they're cold, dry air, stress is a big one, huge, and harsh soaps, detergents, probably dust, mites, pet dander, and certain fabrics like wool. Sweat and heat can also cause flare-ups, and learning your personal triggers is key to the management of this condition.
All right, so let's talk about treatment. Let's start with standard of care in the old days, and let's move on to what I call e-medicine, where we're in the cutting edge. So in the olden days, what were some of the treatments?
Well, then, like today, there was no permanent cure, but we can manage the symptoms very well. The basics, however, is what you're talking about in the older days, and that's using thick, unscented moisturizers daily. They're over the counter. They don't require prescriptions. Applying medicated creams that have steroids in them, however, they do require prescriptions, but they're only for the flares. But if you avoid the triggers, you don't have any flares. That's why there's a blessing in doing that. Now, for some, antihistamines help with the itch. And we now have a non-steroidal cream for sensitive areas like the face.
Well, what is a non-steroidal cream, pray tell?
Well, those are the creams that don't have a steroid in them. Non-steroidal means there's no steroid. So very good anti-inflammatory if it's a steroid, but you can use an antihistamine for anything that takes down the inflammation.
Like Benadryl cream?
Yep. Caladryl, what came in that pink bottle.
Oh, yeah, that's what they used when we had chicken pox.
That's right.
I forgot about that one.
Yeah. There's no question there's more advanced treatments, but some of the old guard, the standbys, still do a very good job.
All right, so now we're going to go into the latest and greatest regenerative treatments. What do you have available that you can teach our audience about?
Well, these are exciting. The platelet-rich plasma, abbreviated PRP, is where you use your own blood to promote healing and reduce inflammation. There's also stem cell therapy that can calm the immune system and rebuild damaged skin. And then, of course, there's peptides. That's really exciting. You have LL